Good evening, everyone. This is Meera, and we have Sumi with us. And today's candidate will be presenting on an important SPT, and we shall see the feedback at the end of the session. So, dear, your timer will start the moment I am putting on the task. Okay, be ready there.
Okay.
Okay, the slide is visible. Okay.
Hello, I'm Dr. Madhuri, one of the doctors in the gynae clinic today. May I confirm your name and age, please?
Doctor, I'm Sarah Michelle, doctor.
Uh, are you 31 years, Sarah?
Yes.
Okay. So I see that you are here to discuss, you have undergone suction evacuation for a surgical procedure for the after having a miscarriage, and now you're here to discuss about the reports of the examination. Am I right?
Doctor, what is happening here, doctor? I had this, removal of the pregnancy tissue, and then now you're calling me. You told me you had to meet me urgently. What's really happening? I'm so anxious, doctor. I just can't understand. What is the reason to call me urgently?
I understand, Sarah, you're so anxious about this. But let me explain you in detail. But before that, I want to ask you some more questions so that I can understand you better, and then I'll explain you everything in detail. Is that okay?
Doctor, I just want to know, did something wrong happen during the surgery? What is happening, doctor? I just can't wait till that, doctor.
Sorry, Sarah, it's not that something mishap has happened, but we haven't expected anything while the procedure was going on. But with this report, there are some issues to be discussed with you, and then I can say you what exactly has happened.
Okay, please go on. What can I do? I just have to wait then.
Okay. Sarah, don't worry, I'll address all your concerns in a while. Sarah, is this a planned pregnancy?
Yes, doctor, it was a planned one. We wanted this baby, and then at 10 weeks they said the baby had miscarried. What is happening? And then this one. So many things.
Yeah, okay. I'm so sorry for the miscarriage. And so, how did this, can you tell me more about how this bleeding has started and you were waiting for an expected management or what happened exactly after the miscarriage?
It was around 10 weeks. I had a scan. They said I miscarried, and then we opted for expectant, and then I just had some bleeding. But then they did some scan, and they said there is some more pregnancy tissue inside. So they said I need to have this suction evacuation of the pregnancy. All this
Mhm.
happened weeks ago, and I thought everything was fine. Then suddenly
Okay.
I got this call. They told me to come urgently, doctor. So there's some
Yes,
report.
I understand, Sarah. Sarah, how are you recovering? Is everything going on well?
Yeah, that's fine. That's fine. No issues, doctor.
Okay, how is your support at home?
That's fine. My husband is very supportive.
Okay, good to know. And what is your blood group?
What are you going to do with my blood group, doctor? Everything is done.
Yeah, I understand, but so there are certain things like if at all very necessary, we just keep everything ready. So that's it. That's all.
Okay.
Just as a precautionary measure.
Positive?
Okay. Do you have any blood reservations?
No.
Okay. Sarah, were you pregnant before?
Yes, doctor, this is my second one. The first one was clean. It was a normal delivery. It was all fine. My son is around 3 years old now.
Okay, that's nice. Have you undergone any surgeries before?
No.
Any other medications you're on?
No, doctor. No, doctor.
Okay. Sarah, just some personal questions like after the procedure, have you been sexually active?
No, not yet.
Okay. So what is your plan for birth spacing and all?
Actually, they said in our next meeting we'll be planning on that. But even we did not decide on anything because we're planning for a large family. So they said we can plan immediately.
Yes, yes, that's nice. Okay, Sarah, and like some more personal questions, like do you take do you smoke or take alcohol or any recreational drugs?
No, doctor.
Okay, okay, thank you, Sarah, for this information. Let me coming to your report, Sarah. Let me explain you. He usually we call this as the retained products of conception. Those are the remains of the pregnancy that will be cleaned from your womb, and these are sent for the histological examination. You're
What's
up to that, right?
What do you mean by histological?
What exactly the tissue is made up of. So that will give an idea if there is any abnormal type of pregnancy. So
Okay.
that is the examination, okay?
Mm.
And so you're not aware anything about this report, right?
Yes, doctor. Doctor, I'm feeling alone, doctor. Would you like to provide some support for me? I'm very anxious, doctor.
Oh, I'm so sorry, Sarah. Shall I ask my midwife to stay with you, or have you come with anybody else?
I would like to have someone with me.
Okay, I'll call my nurse assistant to assist you, okay? Please don't worry. Everything will be fine, okay? Sarah, just what happened with this report is your pregnancy tissue is all just like a normal pregnancy tissue. But other than that, we found some fat cells in that remains of those products, okay?
What does that mean, doctor?
Yeah, that means that there could be some probabilities. Like one could be a small fatty tumor inside or that projecting into your womb. That is one option, and the other option could be like there could be a small injury or perforation inside your womb while this procedure is being done, and so that will bring some fat cells from the momentum, what is called the cover of the your intestines. So it could be
What do
also
you
that.
mean, doctor? You mean you had created a rent in my womb and you're telling it so simply?
No, sorry, Sarah, it's not that. I don't mean that we have really created a perforation or an injury inside your womb. It is a possibility, but let me assure you that the procedure is done by a very inexperienced person. It's not justifying ourselves, but we just wanted to review you if at all, any other consequences are there after this. So that's why we had to call you like this.
Okay, so what does that mean, doctor? What next?
So what next is, if you allow me, I would like to do some examination. We'll check your vital data like your blood pressure, pulse rate, and temperature and all. And Sarah, do you have any abnormal bleeding or any foul-smelling discharge or any fever after this procedure?
No, doctor, I was fine. I was fine. It was
Yeah,
only the
that's a
small that alarmed me, doctor.
Yeah, okay, that's a very good sign actually. And then I'll just do an examination low down on your tummy if I find any points of severe pain on your tummy, and then do a examination from down below in presence of a chaperone if you agree for this. Okay.
Okay, doctor.
Okay, and usually, Sarah, if at all you do not have any of the problems, if it's a major injury, you will be having problems like severe pain, abdomen, or some kind of infection and all, and we need to admit you in the hospital. And I think as of now, you're fine, and we can monitor you from your home itself. Am I clear so far?
Yes, doctor.
Yeah, I'll tell you some red flag signs. If at all you find any of them, you have to report to us immediately. Like you have severe pain, low down in your abdomen, or any foul smelling vaginal discharge, or excessive bleeding, or fever, you need to report to us immediately. And I'll give you some information leaflets, and I'll also arrange a consultation with my consultant as well.
Doctor, I have one more concern, doctor.
Yeah.
So what about we are planning for a large family, and what is this? I cannot get pregnant again because there was a hole in my womb.
Sorry, Sarah, don't worry. Actually, we are expecting that could be one of the complications. But with the presentation you are in the state you are now, you're quite stable, and we expect if at all there is a perforation, it could be very small, and that will heal by itself with time, and you can have a family. Like whenever you and your partner are ready. But as of now,
That's your time,
it's
dear.
better.
Time is up. But
Okay.
please go on. Go on.
Whenever you or your partner are ready, you can plan for the further pregnancy.
Okay, then should I have an operation in my next pregnancy?
Not exactly. If at all we feel that this perforation is large enough or extending through and through the wall of the uterus, then you will be assessed in the next pregnancy, early in the pregnancy itself, and then that will be decided. Then sometimes you'll be needing a cesarean section, planned cesarean section, if we think that this perforation is large enough that could have a problem during delivery.
Okay, doctor.
Any other questions, Sarah?
No, doctor.
Okay. Okay, Sarah, thank you. I'll give you the information leaflets and please go through and get back.
Okay, doctor.
Okay, thank you.
So well done, dear.
Okay, ma'am.
You were able to cover the majority of the chunk. Over to Sumi for the lay feedback and her inputs, please.
Yeah. Dr. Madhuri, you did well. I felt, heard, and also you were able to address all my concerns, except for a few points which I'll be discussing with you. And also you were calm, and you did not, lose control when I was trying to ask you a lot of questions, when I was angry with you. These are all really good points. And initially, you did ask about my recovery. But you did you asked like any symptoms. You can ask a few more questions also. Any foul smell in discharge. You did ask at the end. It's better to ask in the
Forgot.
okay, because asking about recovery is fine, but asking a few more questions would be better. So that would mean that you are looking for any complications after a perforation, any infection or any other complications. And then you did ask about the pregnancy history, previous pregnancies. You covered everything. I think only thing you missed was the asking about medical conditions. You asked about any medications, but medical conditions was missed. And related to blood grouping and reservations, I don't think it's very much necessary. If you are able to complete the information gathering soon, you can ask that also. Because anyway, we won't be planning for anything. It's been 4 weeks since her perforation and she's fine. There won't be any necessity for another surgery. What is important in this task is to, diffuse her anger and let her understand what had happened and explain about further management. And I think you asked about smoking, alcohol, and drugs. Do you think it's necessary?
No, I don't know. I thought for completion's sake I need to ask.
It's not at all necessary here.
Okay.
And other surgery is fine. Most important is related to the history about her recovery, about her mental status. I think you didn't ask about whether she's been assess her mental health also. Any
Just asked if you support
depression or anxiety. Okay, you need to ask specifically. You asked about support. All that was done. This is a very important point. You asked about sexual activity and all. That is also fine. These are the important questions that needs to be that you should not miss here. Okay. And you went on to explain about this. You need to start with a BBN here. It's not a very big BBN, but still it is a short BBN is very important here. You're going to you're giving her a warning sign that something what she's not expecting. You're going to tell her already she's anxious. It's very important. You should give her the support. That is why I came back and I asked you about the support. You shouldn't forget anytime. Anytime when you're going to talk about something more other than normal, it's better to give them support. And a short BBN. I'm going to give you a lot of information today. Would you like to have someone with you? I see you're alone. Just a short one. But for other important BBNs, you need to give it in the proper format. But here, just provide a support. And there were a lot of jargons used. You told histological. You mentioned perforation, momentum. All these were jargons. Okay, you were able to cover the points, but the thing is, a little more practice is needed in order to avoid all these jargons. I tried to put in like what is a tumor also, but you were very much into explaining what had happened. I think you did not listen to that. All this happens in a video call, so that's fine. You need to, practice all this. And also you need to talk about other differentials also. All that Dr. Meera will be telling you. And you didn't offer any other support in the sense she's emotionally affected. So you need to provide some counselors also. That part was missed. And then you went on to tell like I'll be checking you, rule out any complications. All that was done well. And MDD you can involve a few more. All this Meera will be explaining to you. And you explained about the fertility concerns well. It's better before the role play asks you. It's better that you take up this this topic. That's why I was waiting for you to talk about that. This is the most important concern, isn't it? After a perforation, what kind of a perforation it is, all that. And also you need to tell her a few more investigations. All that is also needed. Meera will be covering it. And you offered an information leaflet. Have you ever seen an information leaflet for perforation? Okay. Careful while telling about information leaflets. And you put me in touch with the consultant. All that was fine. You need to work more on the communication part. You were able to address my concerns, but you were able to listen to my concerns, but you're not able to address it completely. Yes, you're able to understand.
Okay.
Okay, you did give time for me to talk, to give my concerns. You did provide me support. You acknowledged, but you need to address it, like what you will be doing for that. Okay, this will come with practice. Okay, yeah. So, Dr. Meera, is there anything else you would like to add, or will you start with
Yeah, I will take up, dear. Yeah, you were comprehensive. Hello, dear.
Hello,
Hello,
ma'am.
Dr. Madhuri. So I'll be looking at your overall performance, and I'll go through the 10 minutes framework and what are all the points to be covered under each domain. Okay. So to start with, let me tell you, this is a critical feedback. It is not to criticize you. Okay. So take it in the constructive manner. So I would like to give that as the first point. So to start with, your time management was not very bad. Most of the points which needed to be mentioned, you were able to mention. The safety netting, one of the most important things you were able to do. But a little more nuances needs to be added, and little more management of time as such needs to be better. Okay. So to start with, you identified her and your opening, what she was here for. It seemed a little bit long. See, what you do in a typical consultation, you will look at the patient and you will address their anxiety immediately, right? In your clinic, that's what you do, right? So look at the candidate instructions that is given to you. It's given that the patient is anxious, right? So you need to start from there. I know that you are anxious. I know that you had been called urgently. Before coming to the results, I would like to rule out certain things. Are you doing well? How have you been after the procedure? Right? You need to be very specific because you are showing to the SSR that you are looking at these points. Okay, you might have something in mind, but if you are talking something else, that might not be reflecting to the examiner, to the assessor who is assessing you. So you need to put certain things in words. Okay. So let me ask you, do you have any concerns like this? Okay. So let me go ahead. I have the reports here with me. So you say that you are here to discuss the reports. Nobody has discussed them with you, right? So, and then you can right away go to the report. Are you with me, dear? Are you with me?
Yeah, sorry, Dr. Meera, I had an emergency. That's all. Okay.
Shall I go ahead?
Yeah, please.
All right. So that is one thing. So the opening and your debrief regarding the report, immediately it should be done. And 2 times the role player should not be prompting you to get back with the report. Okay. So you need to be able to flex a little bit of your template. It need not be the same way as information gathering and then the description and then the report mentioning it in that way at all. It needs to be flexible. So that is one thing. So don't be having your own agenda. With that in mind, you set an agenda, you go to the report and go to the further information gathering, which needs to be asked. Yeah, which needs to be asked because this is, post-operative complication sort of station. Okay, so there, when she was anxious, you showed a little bit of empathy, you addressed that miscarriage, how she has been following that. So that was all right. And the words in which you use to address empathy is important. Don't worry is not something they look for. Okay, don't worry is a little bit paternalizing, don't you think? Don't worry is something what we do in India, but even here people don't accept that anymore, right? So don't worry, you could replace it with something else. We are here to support you. I know that this has been a distressing time for you. Let me arrange some support for you. Were you put in touch with any counselors at all? So this is how you address that empathy. Okay. And you mentioned that support is there at home and you are correlating this with the mental status, right?
Okay.
So this is from what I got from your exchange with Sumi. So this is totally 2 different things. Support is that whoever has support at home, she has another child to take care and she is supported socially or something. That is different from support for mental health. So how she has been, how she's coping following the miscarriage. When as a couple, they are looking ahead following the times after miscarriage. Imagine your clinic patients who come after miscarriage follow up in your clinic. They'll be affected as a couple, right? Right. So you need to give the mental support, mental status examination of the couple and support for the couple. That is how you showcase to the lay examiner. These are all lay examiner points that they will be ticking at you at. Okay. So that is about the mental status. And one more thing I would expect of you is to open your camera when you are discussing with the role player. So the points like how you are as a doctor, your body language, how you are showing your face, how you're acting is also part of thing which needs to be assessed, right? So you could open your camera. The thing is, we won't be putting this in the YouTube, don't worry. So we will be giving in the drive only. Whoever is in our group only will be able to see it. So don't worry there. Okay, so that is one thing. Coming to information gathering, your blood group reservation, it's not wrong. You can ask that because anytime she can come in emergency. So it's not a redundant information gathering, I would feel. So that is all right. Previous surgeries also was fine because, okay, the meeting will end in 10 minutes. Please join back using the same link, all of you, please. It's not wrong to ask previous surgical details. And like Sumi said, the medical history as such, any history at all, medication, like medical disorders, anything at all, you can ask. That's not wrong. Allergy also, you can ask. These are basic things you should never miss. But smoking, alcohol, and drug is not something that you mentioned here at all. And she is here anxiously waiting for her reports. Any, induced role player, they'll be coming back at you. They'll be angry. Okay, if you're asking all the irrelevant information, they'll be asking, they'll be coming back at you. They'll be mentioned, it will be mentioned in the role player's information to get back at the candidates this way. So don't ask all the irrelevant questions. you asked rightly about the sexual activity. What did you have in mind there? And please give a signposting and then come to the sexual history at any time at all. Okay. So what did you have in mind when you asked for the sexual history?
That will accentuate her in any infections. So if
Okay.
at all it's a perforation and
Okay.
regarding birth spacing also, like
Okay.
as a contraceptive precautionary measure.
So you want to say that she
Because
should
it's
not be
already
getting
4
pregnant
weeks
anytime
since,
soon.
uh,
You are asking her to avoid pregnancy.
Not really, just to be aware that if at all she can, because it's already 4 weeks since the procedure has been done. And first thing, I'm worried about the infections. If at all
Okay.
real, it's the perforation. And the second thing, she may get she could get pregnant. That could be an unplanned or unexpected pregnancy.
Okay. So instead of that, you can ask just straight away, are you on any contraception? Any contraceptive advice was given to you? Because you had this in mind, you can just straight away mention that any contraceptive advice was given to you. Because I was thinking, are you thinking in terms of molar pregnancy? That's why I'm asking you. Okay, fine.
Okay.
So that is all right. So she wants another pregnancy. So are you planning immediately, or are you discussed about any contraception options? That will be a very precise question. Okay. And by the time you finish this history, it was 5 minutes. Until this point, where this information about her HPE results was not revealed to her. So you are building up the anxiety. So whenever the role player is asking you something, insisting on something, please go ahead with that, because that is where your marks lie. That is where you are going to score, not with your agenda. Please have that in mind. Okay. And to start with the the assessing the starting point, what she knows so far. That you asked well, that came in at the 3 minutes of introduction, and then coming to a mutual agreement that you are not going to give the HP results anytime soon. So at that time, you asked her background and what she knows so far. So you assessed that information. That is one of the most important points. Sometimes, usually, people miss that, what she knows so far. Okay. So you can start from there. That would be a better way of opening. So you can start with how she has been now, rule out any red flags, and then assess her current understanding of what it was. So we have given this sample to the doctor who specializes in looking it under the microscope to see what exactly the type of tissue that we saw, and we have some concerns there. So this will be like signposting. A warning, okay, a warning shot that something is not what we expect. So, and then you can, not essentially you would be asking for a support here, but since you are prolonging for a long time, this role player was asking for support. Okay, so a short BBN, you need not offer a support. You can just give a warning shot and you can go ahead with the information. Okay, so that should be the way. And coming to the results description, most of the tissues were normal pregnancy tissue. You were right at that. So what were the differentials you had in mind?
Okay, because the HPE won't be sent routinely to every every surgical evacuation of pregnancy.
That is right. So HPE is sent when the patient did not have a proper ultrasound earlier, that it could be a partial molar pregnancy. That is why HPE will be sent, or it would be followed up with a urine pregnancy test. That is what is the protocol, right? So here HPE result was sent. And the HPE result, you are expecting it to be a pregnancy, right? You are ruling out a molar pregnancy, right? So your differentials, you are looking at whether it is a pregnancy at all, and you are telling her that this is not a molar pregnancy. And we also see some other tissue, which usually we don't come across in this sample. These are some fat tissues. So from this, what we think is, there is a possibility, I'm sorry to say, there could have been a complication which we call perforation, in which I can draw a diagram here for you. This is the womb, and when we do the suction evacuation like this, it could go through the womb, and it can injure, cause a rent, and it could have sampled the tissues around, which is usually the fatty layer which covers the bowels inside. So that could be the reason why we see the sample here. So this is like you are performing the duty of candor. At the same time, you are telling her what happened, right? And here you mentioned something like experienced person will be doing. So even before she came back at you, you are being defensive. Do you get that?
Yeah.
So perform that. Yeah. So act more. That's all is required. Act more. So when you are telling the information, perform the duty of candor and tell the information. And we will be looking into it. We will be initiating an internal report. We'll be looking at what exactly happened. We will be looking at your records, and we'll be discussing what exactly happened, and we'll be open and honest in the internal investigation. Okay, so this clinical governance part is one of the most important safety points. You can mention it right away in one point.
Okay. Should I say that an incident report will be raised?
Yeah, because it's a perforation, it's a complication, right? Definitely it should be raised. Okay.
But Dr. Meera, before the surgical evacuation, won't we be in the consent form? Won't there be all the list
So
of
you think
complications?
Yeah, so if a complication has occurred, you will not see,
Uh,
they should accept it, is it? No, at any
no,
point of time,
that is
see, at any point of time, any complication, if it has happened, they will look into it and they'll derive points which could be avoided next time. So whether there is any deficiencies in the learning process or what exactly happened, which need not happen again, right? So they'll be looking at it. So any complication, suppose if there is a PPH, it's one of the acceptable complication. Don't we do an internal audit? Right. So it's not like because it is one set of complication which is expected, it doesn't mean you will not raise an incident report. You are calling her urgently. There is a new finding. What if she lands back again after a delayed perforation, after some bowel symptoms? She can come in, right? So you need to look into it. You need to tell. And the act of commission is not problem here. If you omit it, it's a problem here. The incident
okay.
reporting in the station. So make sure you mention this here, okay? Because it is a perforation. Though it is one of the acceptable complications, this is something which can be prevented. Right. And
Okay.
if she gets back how this happened, yeah, I thought it's rare. I thought one in 2000 only get the perforation. Why I am the one? I think the doctor is at fault. Something she can get back. Right. So you need to perform the duty of candor. You need to look at it, and we will need to be learning from this incident. Okay. So that is the clinical governance part. And the examination you offered rightly. 2 times you mentioned it. The second time you mentioned it with the chaperone. So all this are taking your time away from you. Be very precise in your words and complete it once you utter it. Don't come back to it and complete it. It's taking your time twice, right? And then at that point, you ask the information gathering again. Does she have any symptoms, abdominal symptoms, right? So this should have been your first question. Okay. So there, by the time 10 minutes was coming to an end, you immediately did the safety netting. You mentioned the red flags, and we can monitor you at home. I'll give you this 24/7 contact number. All those things were fine. An information leaflet, like Sumi said, this is not some information leaflet.
Okay.
You just mention and get the marks for it. No. And good assessors, they always look at what information leaflet you are giving. What do you exactly mention? What information leaflet? I'll give you some information leaflet regarding, if it is a missed miscarriage previously when she comes in. At the time, you have to mention, I'll give you some written information about missed miscarriage and what are the options for you. So this is a well laid out information leaflet which you are sharing. So for something like this, like a complication, like a perforation, there is no, made out information leaflet. So don't just mention that and move on. Leave the well laid out information leaflets. And by the time was over, and the role player had some questions which came in later, and future pregnancy details, all those things were covered later. So overall, it was well done. You are a candidate who is preparing, you know how to fine tune. You are taking in the points. So the prospects are looking up. So far, it's good. Okay, so let us go into the 10 minutes framework. So the opening and rapport and assess concerns, that should be part of the immediate point which you would need to do at the outset, because she is one anxious patient and she is with you and she has been called. I'll mute everyone. Any issues at all, you please unmute yourself and ask. So once she is coming here with you, you please ask her the current concerns immediately. What are all the concerns which you need to rule out, right? So I'm one of the doctors here. I understand you are being called urgently, right? I'll give you a clear explanation. So how have you been since the procedure? What worries you most? So of course you'll get back that I'm worried about the results. There you can offer the results after confirming the name and NHS number on the results that reports belongs to you. No, make sure you never miss that. Okay, and mention the reports step by step. All the information needs to be given to her. And when you are mentioning the results, don't say it as an option. Option is something which she's going to go ahead with what are the further options with the treatment. So this is a possibility, right? These are the differentials which you are telling her. So don't mention it as an option. One's possibility is that we might have had a complication, which we call the perforation, in which the operating surgeon might have created a small rent in the womb or mistakenly while doing the procedure. I'm sorry to tell you this. Or it could be that it is something like a tumor you mentioned. And there is one more issue there. Could anyone identify, please? There is one more issue in the report. Could anyone identify what is the one more issue there in the report? I'll give you the report. Is the report visible? So you see the residual tissue and trophoblastic tissue. Adipose tissue is rightly brought up. You ruled out molar pregnancy. Make sure you mention this. There is no abnormal pregnancy as such. So what is this no chorionic villi about? So they don't see any chorionic villus at all. What does it mean? Yes, India?
Choriocarcinoma, ma'am.
Choriocarcinoma, you will see atypical cells and invasion and all that, right?
But
No,
no-
it is not choriocarcinoma. There is no chorionic tissue there. No villi there. I mean, trophoblast is seen, but there is no villi.
Ectopic pregnancy.
Yeah, exactly. It could be a possible ectopic, right? So you would need to be following it up with, who said that? Is that Shruti?
Fatima.
Okay, Fatima, hello. Okay. So yeah, it is a possibility. There is no villi there. So possibly previously it would have been fully evacuated. That is one possibility. Along with perforation, this is a missed miscarriage which was fully evacuated, and there is no villi seen in this sample of the suction evacuation. Okay, so possibly the residual tissue only had been there in that sample. Or it could be a sampling error where they didn't see any villi at all in that sampled area. Okay, or it could be a perforation because there are fat cells. So you need to take all this in, and for that you would need to be following her up, telling her that this is a possibility. Any problem at all, you would need to be coming back again. You can also offer an urine pregnancy test to have a completion because there is no tissue here seen within the villi seen within the HPE sample. So you can mention UPT follow-up. Okay. So this is for this particular report that I'm telling you. Okay. So this is not a key for whatever station came up previously. There are two sets of similar station out there. One is PSTT, one is perforation fat cells. Okay. Are you all with me? So this information is only for this particular station. So this is a patient who had a missed miscarriage. Expectantly, sometime it was followed up, and she had continued bleeding, for which the suction evacuation was done. And the suction evacuation sample shows the decidual tissues only, no and fat cells, and no villi. So because there is no villi, we need to be careful that there is a possibility of ectopic. Or if she has had a previous, before the miscarriage which has happened, previously she had a scan which showed a yolk sac, which showed a fetal pole, then this is not much of a possibility. Most likely that this is a complete miscarriage, and right now, whatever tissue came in was only the decidual tissue. So that is how you need to take it forward. So how you can tell the patient here is, you tell her about the possibility of perforation and that you're concerned no pregnancy tissue is there in the sample. This could be due to completely previously you could have passed the pregnancy tissues. So we did not see anything in the sample which was taken, or the lab did not sample the pregnancy tissue area and we saw only the insides of the womb which was grown. So that way you can mention that and mention
Dr. Meera, excuse me, Dr. Meera, but it's given also that there's a scattered trophoblastic tissue identified.
Yeah, trophoblast is seen. Villi is not seen.
Hmm.
Chorionic villi is not seen.
Okay.
Okay, so if you are thinking in terms of ectopic pregnancy, make sure you give an UPT follow-up and you finish it off there. Okay, and make sure that you mention that this is not an abnormal pregnancy, like a molar pregnancy. So mention the report fully and go ahead with further questions like mental status examination, mental status related questions, future pregnancy plans, what we will be looking at the management part. Okay, so check if she is in the next 2 to 3 minutes, check if she is clinically stable, how the bleeding is, any pain, fever. So specifically you ask these questions. Okay, and go ahead with the further part. So explain the HPE itself. See, at the initial point itself, don't wait till the end. Give a signposting. It's just a single warning shot. You need not give a support as it's not a big deal because she is doing all right. And because it is like complication, avoid being giving positive terms like that is nice, that is good to know. You maintain a neutral stand. Okay, just to say all right, okay, something like that, instead of being happy, showing that you are happy for her. Okay, so this is something possibly which can become problematic, right? So don't be very positive. Now, for explaining the results are partly reassuring, but there is an unexpected finding. There you will be mentioning about whatever we just discussed, that we saw a necrotic tissue, old clots, and we see some unexpected finding, which are fat cells, which are not usually present when we evacuate the womb. Okay. There you did not use much jargon. HPE, when the role player asked you what is histopathology, you gave a very simple explanation which quietened her, and you proceeded with the further part. So most important thing is she is stable right now. Okay, that also you can add to the information once you reassured her, once you gave this information. Okay. And here also don't make this information like it's good that, or it fortunately. So it's like even if you did a mistake, don't try to cover it up. Be very neutral. when telling what status she is in. So it is reassuring that you are doing currently, you are stable, we don't see any warning signs in you. So that way you can mention. Don't give a very positive note. People used to give a very positive note, like if it is a cancer. The good news is that it is a not very aggressive type of cancer. This is a very wrong statement because there is no good news about cancer. So you can mention something like it's reassuring that it is not a very aggressive type. It's reassuring that you are stable right now. So that would be a better way. Okay, so at the end of 3 minutes, make sure you give time for her questions. She'll have a lot of questions and likely questions. Did something go wrong? Was this negligence? Will I be okay? And what about fertility? These are all questions. And like Sumi said, don't wait for the role player to prompt you about fertility because this was a planned pregnancy for her and she might be going ahead with the further pregnancy plans. So right now, since she is doing all right, there is no particular indication that she would need to be waiting to get pregnant. But if she wants contraception, you can send her to the contraception clinic for a safe contraceptive option. But because it's a perforation, it's not advisable to have a coil inside. You can offer her any other type of contraception before she plans for a pregnancy. Okay. All right.
Okay.
Yeah. So at the end, safety net management escalation, mention any management part, start with the mention of who are all the people you are going to come get in together to her care. As such, because you are doing well, nothing much is needed. I'll be discussing about you with the consultant. Okay. And if any concerns at all, we'd be offering you further investigation, bloods at that point, if there are any symptoms. So I'll give you 24/7 contact number. If you have any of these symptoms at all, this, you get back to us immediately. Okay. So this is how you end the station. All right. Okay. So for the information gathering, the current concerns, procedure related history, how her emotional state is in terms of urgency, she has been called back and she is in the post miscarriage state. So these are all the information gathering points and like previous surgical details, okay, allergy details, all those will also be part of it. Examination in the presence of chaperone with her consent. Mention it in one go and go on. Why exactly? What are all you looking for? So that you give it in one go. Communication, don't make her wait. Make sure you are flexible a little, avoid jargons, and simplify your explanation a little bit and use a lot of phrases which will allay her. At the same time, don't patronize her. And practice a lot about how to simplify the sentences. So there are 3 possibilities. Use very short sentences. Don't make it prolonged. And so there is a possibility of there are 3 possibilities here. There are 2 possibilities. 1 is, 2 is, which is why we would be looking at the further management involving these people. So that is how you use this framework. This can be a skeleton for any debrief, any reports discussion station, any management station. Okay, so this communication, discussion of the results and further taking up, you can simplify it a bit. Okay. And check and chunk. Sometimes I felt this was not very much done at the end of the station because the time was running. So you were fast, a little bit speeded up at the end. So chunk the information. After each information, make sure the role player is with you. And yeah, that's it with the communication. Okay. And colleagues, document the plan, what you're going to do and the follow-up. And don't give the defensive statement that people are already experienced who will be doing the procedure. If she gets back at you like somebody did something wrong, you can address that. I can see you are concerned. But generally, those who are experienced, those who are competent enough to do the procedure only will do it. And sometimes, despite the best, with the best of hands, these things can happen. And reassuringly, you are doing all right now. We will be continuously following up. I'll be documenting. We will be looking at this. We take this seriously and we'll be open and honest in our investigation. So that will allay her anxiety and that needs to be mentioned. Okay. So safety points, possible complications, you rightly mentioned, you looked for it, you assessed her red flags, you gave safety netting. Duty of candor and ethics were missing and the rest of the things you were able to mention. Okay. Rest of the things you're able to mention. In future fertility also, you were reassuring. It's not a big perforation. So generally, there'll not be any problem. So, but at the same time, don't be falsely promising her that nothing will happen. So this is an injury through the womb. So this needs to be mentioned. This will be in your notes. This needs to be mentioned if you're going ahead with the future pregnancy. But generally, this as such is not an indication for any problem. I mean, intervention or any cesarean section as such in your next pregnancy. But this will be in your notes. This will be mentioned to your midwife next time you get pregnant. Okay. So that is, again, the follow-up thing. So the applied aspect of it, what to expect when you see a HP result like this, and revise the normal findings, molar pregnancy findings, PSTT findings, so that you don't confuse between these stations. And you did not go for any lab as such right away. So that was one good thing you did. You did not escalate it unnecessarily. You rightly clinically assessed her, and you settled that this is not sinister at this point. We will just keep you under follow-up. And you involved the consultant, so that was fine. Okay, so the applied aspect, just that you need to showcase it a little bit more so that the assessor can give you marks where it is needed. Okay, so most women with minor perforation recover completely and go on to have normal pregnancies. This is how you finish the station. Okay. Yeah.
Okay. Actually, Dr. Meera, I thought this is 4 weeks after the perforation, and just to discuss the report, they called her. So I thought, back of the mind, it's there in my mind that 4 weeks, everything is fine with her. Sure, that's why I gave reassurances.
Yeah. You as a clinician, you are not wrong. But that is a patient who is in front of you, and she is anxious. But she need not take you up for your word. She needs to know what exactly that is, right?
Yeah. Okay.
So once you give her that information that it is not very bad, since you are doing all right, this is something which was not expected, which is why you were called urgently. But rest assured, everything is going on as expected. So that is the initial, being what to say, whatever she wants at that point. She did not believe you. Yeah. So give her what she wants. Allay her anxiety. That is also part of our job, right?
Okay.
So how was the session? Thank you all for participating. Sumi, do you have any further points to add?
No, Meera.
Ma'am, I had one question. Like you said, not to do any blood test. So with this no trophoblastic tissue, we will not tell her. I mean, with this HPE report, it shows that it is a products of miscarriage, right?
Yeah, it's not exactly pregnancy tissue. This is residual tissue is seen, but villi is not seen. So possibly she had trashed the pregnancy tissue fully previously itself, and whatever curettings or suctioning was done, this was only showing the residual tissue, and along with that some fat cells. So you might, trophoblast is there. Trophoblast is there, but there is another place where in the recall this was not there.
Okay, so trophoblast is there means it is a pregnancy tissue, ma'am.
Yeah, that is true. That is true. You previously you asked the right question. That is true, but as such, when no chorionic villi is seen, no pregnancy tissue is seen, make sure you think of an ectopic pregnancy.
Like if they don't write, if there is no trophoblastic.
Yeah. Yes, 100%. Agreed.
Thank you.
So the differentials, welcome dear. So differentials you have to have in mind is a normal pregnancy and perforation or PSTT. Because these are all the recalls which are asked. It could be any partial mole also, it could be molar pregnancy also. Just that the 3 things were asked as recalls. Okay. So thank you everyone.
Thank you, Dr. Meera. Thank you, Dr. Sumi, for your time.
Thank you, Dr. Madhuri. It was nice having you.
Thank you, ma'am. Thank you.
It was an excellent session. Thank you so much.
Most welcome, dear. Thank you for your feedback. Hello, Bhumika. Do you have anything to say? Hello, dear Bhumika. We're not able to hear you, I think. Okay. If there's nothing more, we shall end. Thank you.